Hello there. In today's MHA Brief Explainer, we're going to talk about post-traumatic stress disorder, or PTSD. PTSD is a mental health condition that can develop following exposure to a traumatic event or series of events. It is characterized by symptoms that include intrusive thoughts or memories, avoidance of triggers associated with the trauma, negative changes in mood and cognition, and hyperarousal or an exaggerated startle response. The traumatic event can be a direct personal experience, such as a physical or sexual assault, combat exposure, or a natural disaster. It can also be witnessing or learning about a traumatic event that happened to someone else, such as the sudden death of a loved one, a serious accident, or an act of terrorism. As a mental health professional, it is important to screen and assess for PTSD in patients who have experienced a traumatic event. A thorough assessment should include a detailed history of the event, a review of current symptoms, and an evaluation of comorbid conditions. Treatment should be tailored to the individual and may involve a combination of different approaches, including therapy, medication, and supportive interventions. It is also important to address any barriers to treatment, such as stigma or logistical challenges that may prevent patients from accessing care. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, or DSM-5-TR, post-traumatic stress disorder is a trauma and stress-related disorder that is characterized by the development of specific symptoms following exposure to a traumatic event. The DSM-5-TR defines PTSD as the presence of the following 4 symptom clusters: intrusion symptoms, avoidance symptoms, negative alterations in cognition and mood, and arousal and hyperactivity symptoms. To receive a diagnosis of PTSD, symptoms must be present for at least 1 month, cause significant distress or impairment in social, occupational, or other areas of functioning, and not be better explained by other mental health or medical conditions. As I mentioned earlier, the DSM groups the symptoms of PTSD into 4 categories: intrusion symptoms, avoidance symptoms, negative alterations in cognition and mood, and arousal and reactivity symptoms. Intrusion symptoms include recurrent, involuntary, and distressing memories, nightmares, or flashbacks related to the traumatic event. This may also include intense psychological distress or physiological reactivity when exposed to cues that resemble the trauma. Avoidance symptoms include avoidance of or efforts to avoid trauma-related stimuli, such as thoughts, feelings, or external reminders. This may involve avoiding people, places, or activities that are associated with the traumatic event. Negative alterations in cognition and mood include persistent negative beliefs or expectations about oneself or the world, persistent negative emotional states, feelings of detachment or estrangement from others, and inability to experience positive emotions. Arousal and reactivity symptoms include irritability, angry outbursts, reckless or self-destructive behavior, hypervigilance, exaggerated startle response, and difficulty concentrating or sleeping. The symptoms of PTSD can vary in severity and duration. For some individuals, symptoms may begin immediately after the traumatic event, while for others they may not emerge until weeks, months, or even years later. Symptoms can also fluctuate over time, with some periods of remission and others of exacerbation. Note that the diagnosis of PTSD requires that symptoms last for at least 1 month and cause significant distress or impairment in social, occupational, or other areas of functioning. The diagnosis of PTSD involves a comprehensive evaluation by a mental health professional, usually a psychiatrist, psychologist, or licensed therapist. The diagnostic process typically involves the following steps. Clinical interview. A mental health professional will conduct a detailed interview with the patient to gather information about the nature and timing of the traumatic event, as well as the patient's symptoms and functional impairment. Psychological testing. A mental health professional may use standardized psychological tests or self-report measures to assess the patient's symptoms and cognitive and emotional functioning. Diagnostic criteria. the mental health professional will use the diagnostic criteria for PTSD as defined in the DSM to determine whether the patient meets the criteria for the disorder. The DSM requires the presence of specific symptom clusters including intrusion, avoidance, negative alterations in cognition and mood, and arousal and reactivity, along with functional impairment or distress. Rule out other conditions. The clinician will rule out other potential causes of the patient's symptoms, such as medical or neurological conditions, substance use disorders, or other mental health disorders. Duration of symptoms. The diagnosis of PTSD requires that symptoms have persisted for at least 1 month. Severity of symptoms. The mental health professional will evaluate the severity of the patient's symptoms and the level of functional impairment to determine the appropriate treatment plan. In summary, the diagnosis of PTSD requires a thorough clinical interview, psychological testing, and a careful evaluation of the DSM diagnostic criteria to determine whether the patient's symptoms meet the criteria for the disorder. Post-traumatic stress disorder can be treated effectively with various evidence-based treatment approaches. Some common approaches include cognitive behavioral therapy, or CBT, eye movement desensitization and reprocessing, or EMDR, pharmacotherapy, mindfulness-based interventions such as mindfulness-based stress reduction and mindfulness-based cognitive therapy, psychodynamic therapy, group therapy, and family therapy. Psychedelic-assisted therapies have also emerged as an option for treatment, although research in this area is still in its early stages. In general, the most effective treatment for PTSD is likely to be a combination of different approaches tailored to the individual's specific symptoms and needs. The choice of treatment will depend on the severity of the symptoms, the individual's preferences and goals, and the mental health professional's expertise and experience. We're getting close to the end, so let's look at some key takeaways for this video. PTSD is a mental health condition characterized by symptoms that include intrusive thoughts or memories, avoidance of triggers associated with the trauma, negative changes in mood and cognition, and hyperarousal or an exaggerated startle response. To receive a diagnosis of PTSD, symptoms must be present for at least 1 month, cause significant distress or impairment in social, occupational, or other areas of functioning, and not be better explained by other mental health or medical conditions. The symptoms of PTSD can be grouped into 4 categories: intrusion symptoms, avoidance symptoms, negative alterations in cognition and mood, and arousal and reactivity symptoms. The diagnosis of PTSD requires a comprehensive evaluation by a mental health professional, including a detailed interview, psychological testing, and a careful evaluation of DSM-5 TR diagnostic criteria. Effective treatments for PTSD may include cognitive behavioral therapy, eye movement desensitization and reprocessing, pharmacotherapy, mindfulness-based therapies, psychodynamic therapy, group therapy, and family therapy, with psychedelic-assisted therapies, such as MDMA-assisted therapy, an emerging option for those with treatment-resistant PTSD. I hope you have enjoyed your learning. For more on PTSD, trauma, and a wide range of mental health topics, visit the Mental Health Academy blog on www.mentalhealthacademy.com.au/blog. Thank you for watching.